propose once again establishing a time limit for REACH recipients who do not meet hardship criteria. A 5-year limit is very generous at any time, but particularly now in the face of our fiscal challenges. My budget also includes a series of adjustments focused on providers, including targeted reimbursement rate reductions for home health agencies, across-the-board grant and rate reductions for smaller providers working with the Department for Children and Families, and increased receipts of $7 million from hospitals by keeping their tax rate at the same level as last year. Further, to uphold our strong commitment to alcohol and drug abuse programs, which I've long championed, we must better align services with needs. Because we've seen underutilization of some inpatient adolescent services, I propose funding them on an as-needed basis with a corresponding reimbursement rate reduction. We know that these proposals will be a struggle for some organizations that are already adjusting the reductions made last year. As such, we're committed to working with nonprofits to reduce administrative burdens that detract from their ability to deliver efficient quality care. While we make these difficult decisions, we must continue our investment in our innovative Vermont Blueprint for Health. That's why my budget supports the continued expansion of this successful program with the goal of having it available in all communities. I also call on our private insurance partners to make this goal achievable within the next 2 years. The Blueprint is our best hope for slowing the growth in healthcare spending while improving the quality of healthcare received, something that all Vermonters want and need. Vermont's Medicaid program is among the most generous in the nation. We can all be proud of the efforts to expand coverage because better health outcomes are achieved when people get care before they get sick. But maintaining coverage for the greatest number of people will mean scaling back benefits for some. Throughout the summer and fall, state workers were asked to take a fresh look at areas of government where we could do better. One such Tiger team considered improvements to our Medicaid system. After reviewing 10 states that, like Vermont, provide generous services, the team saw that Vermont sets few limits on utilization. For example, we pay for an unlimited number of emergency room visits. Capping ER visits that do not result in hospitalization at 12 per year will bring Vermont more in line with peer states, saving money to preserve this benefit for everyone in the system. Another example is the adult dental benefit, now set at a maximum of $495 per year. By reducing the cap to $200 a year, we'll save over $500,000 in the general fund without eliminating this important benefit altogether. Ensuring more Vermonters is the goal of paramount health. During this economic downturn, when many other states have seen an increase in uninsured residents, Vermont's numbers have remained steady. In fact, during the past 2 years, we've succeeded in lowering our uninsured rate, which is now among the lowest in the nation. To make certain that Vermonters have access to affordable quality care, we need to protect Catamount by making it sustainable. This will require a significant increase in deductibles, which will also more closely align our program with industry standards. In our Medicaid programs, most premiums have not been increased since 2006. Modest increases next year for a number of these programs are necessary to protect them during tough times. Finally, this budget will increase our focus on fraud detection and program integrity, ensuring that those applying for benefits meet the income and asset requirements. By more closely monitoring provider billing, we'll ensure that services are paid accurately. And by making small but important investments now, we can curtail inappropriate usage to realize savings and preserve programs for those with real needs. I understand that these changes will generate considerable debate, but I've seen the alternatives, and they're much worse. These decisions are responsible without being draconian, and they will put our safety net on a sustainable path for years to come. Our pension systems are likewise in crisis. If we do not change course, future legislatures will be unable to keep our retirement promises to state workers and teachers. Without reform, the total required contribution from all funds to the two systems will grow by $32 billion, an incredible one-year increase of 43%. In the general fund, pension contributions are projected to consume 8% of available resources next year, squeezing out other priorities. Moreover, the unfunded long-term liabilities in the systems exceed $2 billion, and if not addressed, will threaten benefits and state budgets for years to come. Last year, the legislature established a commission to review these systems and make recommendations to safeguard their solvency while holding the state's pension contribution to a reasonable 3.5% growth rate. I want to commend the commission, Treasurer Spalding in particular, for its hard work and leadership. Their recommendations to adjust retiree age, final benefits, and the annual contribution are responsible approaches, and as such, I include them in my budget. Although these changes will be difficult, inaction would be irresponsible. It's important to remember that while the retirement age will increase and employees will be asked to contribute more, this is necessary to protect a guaranteed benefit. Retired state employees and teachers are assured pensions and subsidized health care for life, something most Vermonters do not receive. The pension system is a problem of not just how much we pay, but also who pays. Currently, the teacher's retirement system is funded entirely by the general fund, despite the fact that the salaries used to calculate pensions are set at the local level. Teacher retirement, like salaries or student transportation, is an education expense, pure and simple, and should be borne by the education fund. But if the expense of the retirement system is transferred without offsetting cuts to education spending, it will raise property taxes. Let me be absolutely clear, that is not what I'm proposing. Instead, as part of my education reforms, I propose to phase teachers' retirement costs in the education fund over 4 years. With the reforms, I propose to normalize the student-to-teacher ratio, and by asking teachers to pay 20% of their health care premiums, the additional expense of teachers' retirement is covered. In fact, my package of education proposals will cut property tax rates by 1 cent next year, rather than require a 2-cent increase if no action is taken. Those who attempt to parse my proposals to justify a claim of a tax increase should be reminded that by advocating for the status quo, they are in fact supporting a $59 million property tax increase. That is a burden Vermonters simply cannot afford. In the general fund, $38 million in government efficiency challenges, $53 million in human service adjustments, $25 million in pension changes, $10 million in education reforms, $5.5 million in labor savings from the contract ratified by state workers bring us a long way to covering our $150 million shortfall. But there are other reforms we must undertake to balance the fiscal 2011 budget and deliver sustainable savings for taxpayers. One such effort is an evaluation of the 300 boards and commissions that regulate or advise on everything from world trade to well drilling. While most provide a valuable service, some have not met for years, while others share similar missions and constituencies. I asked one of the Tiger teams to consider efficiencies and savings throughout the system. As a result of their recommendations, I presented a plan to the General Assembly to abolish, consolidate, or otherwise modify as many as 50 boards and commissions. Just as we focus our efforts within state government, we must also seek efficiencies from those entities that receive a large share of their budgets from taxpayers. Our affordable housing programs provide critical services to Vermonters of various income levels and stages of life. Ensuring that the people of our state can meet basic housing needs has long been a priority of mine. That's why I asked the Tiger team to look at ways to enhance our affordable housing efforts while making our statewide network